right, we'll just give it a moment here and then we'll get started. We should be live here, Rena.
Great. Looking forward to it.
Okay, I think we're good here, Rena. So it's Dr. Rick Maida here, running for United States Senate, and I'm here with my brilliant sister, younger sister, I should add, to talk about the coronavirus and COVID-19. Look, this is trying times for all of us, and we're all working together to get through this. And in New Jersey, especially, we've been very hard hit. As such, we got to work together to make sure that we're doing everything we can to follow the rules. But this particular video is really geared to those that have either been testing positive, have family members or friends that have tested positive, and understanding what it means to help demystify the disease based on whatever science is available that we know. I know from my end, I've been pushing very hard to protect the regulations that the FDA has in creating emergency use authorization for hydroxychloroquine. And here today, I'm joined, as I mentioned, with my sister, Dr. Rena Mehta, who is a pediatrician and also an allergy immunologist from Uptown Allergy and Asthma Center. So Dr. Mehta, thank you so much for joining us and being here with me today.
Thank you for having me. As a former resident of the state of New Jersey, the state is very near and dear to my heart. And so I'm here today to hopefully answer any questions that you all may have regarding COVID-19, its impact on children, as well as treatment options, and as an immunologist, how this disease may affect the immune system. So thank you for having me.
Yeah, Rena, we really appreciate you, and hopefully we can get you to move back to New Jersey as well. So I know you had your practice in Bergen County before, and Bergen County in particular is very hard hit right now. So let's start with the question I think that's on the top of mind from everyone, right? Let's start with the hypothetical. You're not feeling well, you might have a fever, maybe a little bit of dry cough. First start, how do we allay people's concerns from panicking? We're also entering allergy season as well. So let's start with the basics. How do you distinguish testing positive for the coronavirus or having it and understanding the symptoms? What should people expect in terms of symptomology versus having just seasonal allergies?
Okay, so I think the most important to know and to not panic about is that more than 80% of people who do contract COVID-19 will have a very mild illness. And so the majority of people who do get the virus are going to have a very mild course. Typically something as fever, as you mentioned, dry cough, those are the two most common symptoms. Now, obviously with the allergy season, it can be confusing. What's COVID-19? What are allergies? Is my cough from allergies or asthma, or is it related to a virus? So I think in answer to your question, the biggest distinguishing feature between COVID-19 and allergies is fever. And so if you have a fever, typically that is usually some sort of an illness as opposed to allergies. Allergies do not present with fever. The other important thing to note when it comes to allergies, most people have some level of itchiness, whether it's an itchy nose, itchy eyes, itchy skin. And so I think if you're feeling symptoms of, I really want to just scratch myself, that's not usually something that's related to COVID-19 or another viral illness. So I think it's important to go back to the drawing board and say, okay, this spring, how do I feel? And how did I feel last spring? Last spring, if you had very similar symptoms, such as itchy eyes, itchy nose, you're very likely to have allergies as opposed to a viral illness. Now, again, if you develop a fever, then it's important to kind of talk to your healthcare provider to see, do I have COVID-19? What are my risk factors? And do I need to get tested?
Great. Thank you. That's very helpful. So just to sum up for those that are out there, right now we're entering allergy season. In New Jersey, it's bad. And so the biggest distinguishing symptom between COVID-19 and having just seasonal allergies is whether or not you present with the fever. So, all right, well, let's move on that sort of decision tree.
One more comment. If you're really trying to decide between allergies and the virus, the other thing that you can do is maybe take an allergy medication, such as a Zyrtec or a Claritin. And if it helps, then you're very likely to have allergies. Typically, allergy medications don't do anything for a virus.
Okay, that's helpful, and appreciate that clarification. So, and we're going to talk a bit about that because I want to get into what it means for treatment options. But moving down the decision tree, let's say now you've presented with a fever. What do you recommend for someone to then do next?
Okay, so I mean, it also depends on your risk factors and your comorbidities. What I mean by that is, how old are you? If you are a child, very likely you are going to have a mild course. And so I would suggest if your child has a fever, to kind of think about COVID-19 as a possibility, but usually most children do very well from the disease. It's like any other cold. And so I would call your pediatrician. I would not go running to the emergency room or the urgent care if you have very mild symptoms. If you're concerned about whether you have COVID-19, you should first call your doctor to discuss whether or not you should get tested. Because as I mentioned, most people are going to have a mild course. Now, the converse is true. If you're elderly or you have other medical problems such as diabetes, high blood pressure, chronic lung disease, and if you're having some of the symptoms of shortness of breath or difficulty breathing, then of course you want to think about, do I need to get urgent evaluation in the emergency room? And so I think it really depends on what to do. It depends on your age and your other illnesses that you may have.
Right. And just for a disclaimer for those that are out there, take this as general educational. And if you are experiencing symptoms, please reach out to your doctor and talk to your doctor. So Rena, that's really helpful. And kind of following that, and the focus of today is on two things. One, on the hypothetical, I've been diagnosed with COVID, now what? And then secondly, we want to talk about families that have children, right? How do you protect your kids? Are kids susceptible to this disease? So let's start with the children aspects, because as a father of 3 kids, and of course, my niece and nephew, your kids, those 5 little rugrats are the most important thing to me. And I know a lot of parents are out there a little bit concerned and worried. So from your lens as a pediatrician and an immunologist, can you talk a little bit about what COVID-19 means for us in children?
Sure, that's a great question. And so looking at the data that we have so far, because of course we have limited data since this is a novel virus, meaning it's a new virus. We've never seen this strain of coronavirus before, but looking at the information that we do have, when they studied China, because as we know, this is where the virus originated, so looking at a study from China, what they found is people that were less than 18 years of age, they only made up 2.4% of the population with COVID-19. And so what that means is that people who have young children who are otherwise healthy, they are less likely to get the illness, or if they get COVID-19, typically it's a much milder course. So like I mentioned before, in children who are otherwise healthy, it's going to look like the common cold. It's going to possibly be fever, runny nose, and some cough, but usually, as with any cold that a child may have, it's going to run its course. What we worry about with children, though, is them being exposed to the elderly. So with the elderly, it's a much different story. Those are the ones that we worry about getting a more severe illness and ending up in the hospital. So for those of you with children at home, it's important to, minimize exposure, decrease exposure, and stay home, because we are really trying to prevent the transmission of the virus to those who have other medical problems in the elderly population so that they don't get sick and end up in the hospital.
Yeah, that's a good clarification. So it's good to know to start out with, if you're a parent with kids in general, kids should run its course, and the impact of the disease we haven't seen it being as serious in kids than those who are of a more advanced age. That being said, children who may be otherwise immunocompromised or have other medical conditions, you would say it's still a bit of a concern?
Exactly. So I think if you have a child who has medical problems or they're immunocompromised, then of course it's a concern because their immune system just isn't as strong to fight the infection. Within the aspect of children, though, and like I said, children only make about 2 to 3% of the infection population, but those, the ones who are the most at risk of getting a more severe course are babies. And the reason for that is because babies just, their immune system is weak. It's not mature yet because they haven't been exposed to as viruses in their lives to be mount as strong of an immune response. So I think, like I mentioned, most children do well, but out of those who may have a more significant or a severe course, the ones we want to worry about are the ones who have underlying medical problems or babies because their immune system just isn't as strong to mount a response to this virus, to fight the virus.
Right. Right. No, I think that's good and that's helpful. That being said, it's to your point, it's still very important, would you say, for children to also follow some of the guidelines put out in terms of social distancing? I know here for our school district here in Morris County, and I live in Chester Township, our schools have been closed and they've moved our entire curriculum to online through Zoom and other, online forums. So you would still recommend that children be kept social distance. And I only mention that because the other day, I had to go to the grocery store to buy some milk provisions. And I saw a family there with their kids. And it was actually the only family I saw in the grocery store. I was a bit surprised. But what are your thoughts about, taking kids out right now to the store?
So that's a really great question. I mean, I think the best thing that we did for children is close down the schools, because what we're finding is that children are often the asymptomatic or the asymptomatic carriers. What that means is that these children have no symptoms or very mild symptoms, and that's how we're transmitting the illness. So keeping children at home right now is very important to reduce the transmission rate of this virus. So I know it's difficult right now to keep kids contained. They're not in school, to stay home. And I'm not saying, don't go outside at all. What I'm suggesting is don't go to public community places. If your child needs to go out in the backyard and run around to let loose and, expend some energy, that is absolutely perfectly fine. What I'm saying is keep kids at home outside of the public viewing. So of course, now you're a family of 5 and you go to the grocery store. Now that's increasing also your risk of exposure by 5 times. Now this could be something where it's just one person who goes and your risk of exposure is just for one person. You bring 5 people to the grocery store and people touch things, now your risk of exposure is 5 times what it otherwise would be. So not only keeping children home to reduce the risk of transmission to others, but also to reduce your exposure risk for your family. So if you have the option to keep kids outside of the grocery store, outside of the parks, and outside of places where other people get together, I would highly suggest to do so.
Yeah, no, that's sage advice, and I agree. I mean, I think at least my little 3 guys, they're just germ-infested carriers anyway. So, it makes sense. The other day, after it rained, I saw them build an entire pond of worms. So they'll get their hands on anything, and they have no problems licking anything either, whether it's a grocery cart or whatever. So, yeah, just in general practice, it's a good idea.
Let's say, you don't have childcare and you have no choice. You need to get groceries, and yet you have to bring your 2 to 3 kids with you. The CDC is recommending that anybody over the age of 2 to wear a mask or a cloth covering their nose and their mouth. So anybody over the age of 2 should be wearing a mask when out in the public to reduce the risk of transmission as well.
So that's good. And actually, you just answered my next question, which is if you have to take your kids out, what do you do? And on a subsequent video after this, I've commandeered my wife to do a little tutorial on how to make cloth masks. So we're going to stay tuned for that one. That'll be fun. But that's good. Yeah. So put on masks, keep them covered, wear gloves, and keep hand sanitizers with you, right?
And there's one other point I'd like to make. So let's say you have to go to the grocery store with your family. They're making good regulatory measurements in many of the stores now. We're keeping, one person comes in, one person comes out, which is great. Trying to maintain that 6 feet of distance is very important. And so because of the risk of transmission of respiratory droplets, that is the distance that we know now that you need to stay away from somebody in order to prevent their respiratory droplets getting on you. So thinking about, okay, the cashier or your neighbor in the grocery store who's right next to you, you want to try to maintain distance. You want to maintain distance not only for yourself, but also for that cashier who has no choice but to come in contact with so many different people. So wear a mask, keep your distance. And the other thing is when you're in the grocery store and you're touching things, try not to touch your face and your mouth and your lips and your nose, because that once you touch yourself and you have virus on your hands, that is how you get this virus.
Okay. No, that's, thank you for clarifying that. I think that's really important. And just to highlight the 2 points you just made, one is not just, look out for yourself, but look out for others, especially our frontline workers that are out there, our cashiers, our grocery store workers, our truckers, and others that are putting themselves out there as essential workers to make sure that our life can be as normal as possible during this pandemic. And then secondly, just to exert good common practice and keep your distance so that droplets don't spread, minimize the chance of droplets spreading if you have to be out there in public. So that's great. So then let's continue down this path as we're walking, because in New Jersey, look, I think, everyone's working really hard, and I commend you and a lot of my friends that are health professionals. I used to work at Robert Wood Johnson Hospital, which in New Brunswick, and they're all fighting the good fight as frontline healthcare workers, trying to help patients and minimizing the spread of the disease and helping to treat patients. But, the case rate continues to climb. I think we're starting to flatten the curve a little bit, but New Jersey happens to be a hotspot. It's the epicenter of the disease, the Times overflow from New York City. I want to get into the conversation now to direct it to people that have just tested positive. We recently found out that one of our family members tested positive. And so it's a scary thing. And I want to demystify that and what it could mean. So let's walk through the hypothetical. So you've tested positive for coronavirus. What now?
What now? The most important thing is to isolate yourself. At this point, once you test positive, you really need to take good measures not to transmit to other people. And so what I mean is not just isolate in your home, I mean isolate from everybody in your home if possible. So you want to quarantine yourself in your own room and minimize contact with anybody else as much as you possibly can. If you need to go out to go do something, you don't leave your house, meaning like you need to go to the kitchen to get something, you should be wearing a mask. The reason for that is that your respiratory droplets are infectious and you want to protect your family members from getting the virus. Now, like I mentioned before, more than 80% of people are going to have a mild course. So you want to just, pay attention to your symptoms, take care of yourself, get good rest, stay hydrated, stay in your room and stay isolated. And, eventually it will ride its course. The virus will ride its course, whether it takes, 5 days, 7 days, 10 days, you will get better and come on the other end of it. Now, if you start having any worsening of symptoms, so that means, you start having difficulty breathing, shortness of breath, wheezing, you just don't feel well, you're not able to keep down, liquids and stay hydrated, then those are reasons to seek medical care. So those would be reasons why you either call your doctor or you go to the emergency room, because that could be more concerning that you need advanced medical care.
Great. So would you say that most people that you're seeing that have the virus are able to stay home and kind of, what's the right word, ride it out?
The majority of people can stay home and ride it out, and you try to mitigate the chance of your other family members being sick. Well, that's hard. That's the majority of what we are seeing, even though obviously in the news and in the hospitals, we see something different because that's the severe that's reported, but the majority of the people will do well if they stay home, take care of themselves, and just ride it out.
Good. Yeah, that's great. Great to know. And so there's not necessarily sounding the alarm bells to run directly to the emergency room or to the doctor, to stay calm, not to panic, and let your own body fight the infection first as your first line of defense. I think, and correct me if I'm wrong, we're seeing a greater number of cases in those that have other comorbid disease states, or immunocompromised, or smokers and others that are already predisposed to having, lung infections or a weakness of their immune system, right? So the general population.
We're not seeing more illness, but we're seeing more severe illness
More
in those.
severe illness.
Yeah.
Okay.
Yes.
Yeah, that's important. Good distinction. Okay. So, all right. So let's continue down this journey, right? So you've been diagnosed. You are, for the most part, most people seem to be able to sort of quote unquote write it out. But now you are actually becoming more symptomatic and it's worsening. I want to talk about what are treatment options, pharmacological options or others, that you're seeing in practice. And if you can walk us through, because I'll give you a little bit of background before we jump in. There's obviously a lot of conversation being had about an old anti-malarial drug, hydroxychloroquine and chloroquine. And I believe when I first heard about it, I was surprised. I never thought that, this old anti-malaria drug, quinine in and of itself found in tonic water, would be used potentially as an antiviral, anti-infective product. And in general, there are no real true curative tablets against antiviruses like we have with antibiotics work against bacterial infections, right? So the most important tool to stop the spread of viruses is actually vaccines, which is just another way of stimulating your own antigenic response, stimulating the production of your own antibodies specific to fight that particular virus. So we know virus vaccine development is months out, right? But now those people that are testing positive, can you talk about, I know the Infectious Disease Society of America recently sent out some guidelines. The FDA, I think, took a really smart decision to allow for the emergency use authorization of hydroxychloroquine until more data and science has been developed as to whether or not it's effective. And studies are still out there and developing. So can you walk through what some of these treatment options are and what you've seen and some of the study and data that support it?
Sure. Okay. First, start with saying there have been no approved treatment options for COVID-19 as of yet. Obviously, with this, like I mentioned, being a novel virus and being new, currently there is nothing that is approved. Large clinical trials are underway, but we don't have that information yet. So in terms of prevention of getting the infection, all we have right now is avoiding the exposure by social distancing and good hand hygiene, good washing hands and using disinfectants. Let me just start by that's what we know works. Avoiding known exposure and sanitizing, disinfecting, and hand washing. Okay. But that being said, obviously it's still spreading and people are still getting sick. And so we have had a few potentially promising treatment options in the works. And so the first one you mentioned was hydroxychloroquine. So hydroxychloroquine, like you mentioned, is a drug that's been used to treat malaria and other autoimmune conditions such as lupus and rheumatoid arthritis. What we do know about hydroxychloroquine, at least in laboratory data, is that it has some antiviral properties, which is why the thought was to try to use this medication against COVID-19 since we have nothing else to treat it. And so there hasn't been a lot of published data, but the one study from Wuhan, China, looked at 62 people with tested positive for COVID-19. And what they found was that more than 2/3 of those patients actually had an improvement in their symptoms, meaning that their fever curve went down super and their cough and pneumonia symptoms improved faster than those who did not receive the treatment. And so that's where we're extrapolating the information that hydroxychloroquine may help patients with COVID-19 based on what we have seen done in China. So at this time, while it's not approved, the thought is that it may help some. And so if we can get it to the right patients, they may have some improvement in their symptoms. Now, there's been some data that shows that when it's not used in the appropriate dosing, there have been some concerns about it causing heart issues such as an irregular heartbeat. And so that's where we're getting a little bit, we're not using it for everybody, but we are using it in certain patients that we think would benefit. So I think, if you're wondering whether you would be the kind of person who might need it, it's something that you should talk to your doctor, because it's not for everyone, but the safety profile of it is good, meaning it's fairly safe if you use it in appropriate doses.
That's good.
More studies need to be done, of course.
Yeah, let's pause on that, because it's good to know that there are some antiviral properties we don't know yet. And as you mentioned, so the key takeaways is that there's just small studies right now, some coming out of France actually right now, that are showing some promising, like you said, promising results, but we don't know definitively, right? There isn't robust science. And frankly speaking, as someone who used to work at the FDA with a background in public health as a pharmacist, it's nearly impossible to collect the robust data you would need for a full FDA approval of a drug at this time. And that's why I applaud the commissioner for making it available under emergency use authorization. So technically it's approved for an unapproved use until there's full FDA approval for the use of it. And, as you said, hydroxychloroquine, Plaquenil is the brand name, is commonly used for autoimmune diseases. I'll take a minute to say that we need to focus on bringing and building out our supply chain back to America so we have a greater availability and not shortages of this product. So I think that's really key and important. On children. Is there any recommendations you have in terms of nutritional or food? What food is good to eat during this situation? Is there any data to support, building a stronger immune system or response?
That's a good question. I do get this question a lot. Patients of mine who are trying to figure out what I can do to prevent getting this by natural ways. And so there is no data yet that supports, take this much of this supplement or that much of that supplement. There really is no good data to support that. So I would just say maintaining a nutritious diet, trying to keep on top of your immune system, meaning getting good vitamin C, getting good vitamin D, whatever you would normally do, but to an improved level, getting good sleep, staying hydrated, all of those things. You just want to be at the prime of your health right now, but there is no data that says certain supplements have proven to be better than others in terms of prevention of getting the virus.
Good. Yeah, that's great. And, we have a cousin who's a nutritionalist. Maybe we need to bring her on next time as well to talk a little bit further about this. But it's a good point right now, because I'll tell you again, as someone who has taken enforcement actions against companies, unfortunately, there's a lot of unscrupulous actors who will take advantage of this. In fact, if you go to the FDA website, you can see targeted enforcement against companies that are claiming to have dietary supplements or cure-alls against the coronavirus. And I can't stress enough, don't be duped by those. To your earlier point, there are no FDA-approved products other than what's under emergency use authorization. And so anyone who's out there touting any cure-alls or homeopaths or any herbal remedies, they're not necessarily proven to test. And now I'm not saying don't take it. Certainly there's a lot of data that support, taking vitamin C and other nutritional vitamins and minerals and things to help boost your immune system. But all of that goes to helping for you to help boost and increase your immune system, exercise, eat right, and follow all those guidelines, which will help you keep a healthy natural defense against the virus, either A, to help prevent to get it, or B, to help fight it off if you do get it. But nothing that necessarily holds sort of an FDA stamp of approval right now. Okay, let's go back. Thanks for answering that. Let's go back to the treatment options. So that was one, hydroxychloroquine, chloroquine. I also want to talk about, there's a lot of conversation now around what we call, and correct me if I'm wrong, convalescent plasma or convalescent, treatment and antibodies. And I think for those that are listening out there, what that basically means is that someone who's been sick and had the coronavirus and now they're feeling better and now they're out of the woods and they're fine, have developed a certain immune system and immunological response and developed antibodies against the coronavirus. can they take their blood and their plasma of those antibodies and sort of transfuse them into those that are sick? Can you talk about that as a treatment option a little bit? What does that all mean?
Sure. So, I mean, this part I think is where the therapeutic options are going to be. And so, basically, what you're suggesting is, okay, I've had COVID-19 and I did fine, and I'm on the other end of it now, and I have antibodies to it. So then I go and I donate blood. And then the thought is that if you can take my donated blood, and obviously it's filtered and it's purified and it's cleaned, and then it's given to somebody else who's trying to fight the infection, would they have a benefit? And yes, I mean, we're just starting to get into that phase right now where we're able to find some select patients who are severely ill and give them this convalescent plasma. And it's showing that it works. It works because they're getting some antibody response to then help fight this infection. And so I think that this is going to be what's going to help patients who are severely ill the most, rather than some of these other medications where we just don't know what the mechanism of action is and what its antiviral properties may or may not be.
So, and so it's not just simply transfusing your blood to another person. There's a process. So, what people who have had the infection and have then subsequently fought it and are feeling better can do is contact their donation centers.
Exactly. You contact your donation center and see if it's an option. This is just kind of in the starting phase. And so, with the months to come, this is obviously going to become more of a sought out treatment option, as well as the antibody testing, which is hopefully going to be available. And we can use that to see who has and who has not had the infection.
Great. So, okay, so let's keep talking about other treatment options. So then the natural conversation also is around antibodies generally. So if you want to just talk a little bit about different antibodies, I know there's a monoclonal antibody that may have some promising data available to it. And my own biotech company, we're in early stage conversations about extracting antibodies and IgA in the use of lungs from human breast milk. But can you just talk about some of the development areas in this space?
I mean, there's a lot of different ideas and thoughts and medications that are currently being studied. So, like you mentioned, there's lots of different monoclonal antibodies that they're looking at. Basically, the focus is, can we get antibodies from this virus that we can then give to other people to mount an immune response? And so, without getting into extreme detail about all the different studies, basically the concept is, if we can figure out a way to isolate these antibodies and give it to somebody who has the virus, or get it in a way to prevent them from getting the virus, that would be the goal. And so that's basically where the studies are and what we're looking into. You mentioned a good point about breast milk. And so I've not to change the topic completely, but I think it's an important point. Being a pediatrician, I've had a lot of families call me and ask me, well, okay, as a mother, I have symptoms of COVID-19. Can I breastfeed my child? And so the answer to that is yes. Because obviously you're trying to nourish your child, as well as trying to give as much antibodies as possible as you can. And so the answer to that is yes, assuming that obviously you wear a mask, you wash your hands, you sanitize as much as you can before and after the process. But the natural transmission of antibodies from mother to through breast milk is a good thing, and may actually provide some protection.
And I would just advise people who are looking to do that to consult and talk to their doctor first. But that seems to be the general educational advice that can be good to pass along that maternal immunity to their child. So that's great. That's very helpful. So you've covered, now we started with some of the anti-malarial drugs as a treatment option. You covered a bit about the convalescent plasma or antibodies, meaning transferring from one person to another, someone who was sick and now recovered. You talked a little bit about antibodies. I think IVIG is still out there, which is just intravenous immunoglobulins. Can you talk a little bit about now moving along that spectrum to antivirals? I mean, look, everyone's familiar with viruses, right? There's HIV, there's other viruses that are out there where there's certain treatment options. Can you talk a little bit about that, and then talk about some of the more developmental treatment like remdesivir and
I was about to mention remdesivir. So remdesivir is an HIV or antiviral drug used in the HIV population. But what the unique thing about remdesivir is it has a high antiviral property against a lot of different what we call RNA viruses, with coronavirus being one of them. So that's where this drug initially started being looked into, is because of its high antiviral properties for RNA viruses. And so what we found with remdesivir is that in patients who are very ill, who are in critical condition and severely ill, it actually has improved some outcomes by about 2/3, about 60%. And so again, while these studies are very, very small, with obviously, like I mentioned, the severely ill are the smallest population. And so while the studies are small, results may be promising that in those who are acutely, severely, critically ill, there may be some benefit in using remdesivir. So it is a drug that you're able to get through certain programs which obviously, Rick, you can talk more about, but certain programs that are available through the hospital systems, where if somebody is very, very ill, they may qualify to try this treatment option.
Yeah, that's a good point. And so just talk about it procedurally. These programs are available through clinical trials or expanded use. And so your doctor would have to contact and get enrolled in the program with the company in order to get the patient engaged. And so right now there's a lot of treatment options or clinical trials that are going on in order to make sure that there's controlled access and that it's being monitored closely to show that the product is actually working in those patients. So that's a great point too.
Might I add, all of these treatment options that we're discussing are for patients who are sick from the virus. I'm not, those who have a little bit of a cold or a fever, who are staying home but otherwise well, these are not treatment options for you. What we're talking about, all of these drugs in clinical trials are for those who are patients who are in the hospital, or those who are very ill from the virus. So it wouldn't be a situation where you call your doctor and say, I'm feeling fine, but can I get remdesivir? It doesn't work like that. You actually have to be very ill and qualify for the medication.
Right. And so look, there's a lot more areas that are developing. Are there other treatment options that we haven't covered or that you want to touch upon for patients that have now tested positive that are symptomatic for this?
I think that was pretty much it. I think the convalescent plasma, in my opinion, is the most promising, because we know how it works, and now that we've had enough people infected who are on the other end of it, the ability to give their antibodies to those who are very ill is very exciting. So I think we've covered most of the treatment options that we know. There's some data that shows that certain treatments should not be used in patients who test positive for COVID-19. There's questionable use of whether steroids such as prednisone should be given to those who are very sick from COVID-19. So those are some other things, like warning signs of what not to do if you're very sick from COVID-19, and that includes the use of steroids.
Yeah, and I was going to say, so then some patients that suffer from respiratory distress, there's a lot of shortness of breath in patients, but those that truly are having problems with breathing, they then subsequently get intubated, right?
They may, not everybody, but the hope is that intubation is the last step. But if you do end up on a respirator, that's kind of when you're quite severe along in the course.
Okay. So speaking a little bit more broadly, it sounds like, with the combination of some of the, developing treatment options and coupled with some of the, policies in place for social distancing, we are starting to see some flattening of the curve, would you say?
Yeah, yes, we are in certain high areas, such as where you are in New Jersey. We peaked, and so hopefully now we're coming out on the other end. The curve is flattening, and I mean, everybody's doing a good job. It's really important to social distance, because the best way to reduce transmission of this virus is to not be around other people. Not transmit your droplets, to use good hand sanitation, and all of those things that we previously talked about. So I think the biggest thing that you can do is stay home.
Right. Yeah, absolutely. And for those that don't have the pleasure of doing that, we again applaud all those and commend all those that are on the front lines, like yourself. If so now we're in the last closing remarks. Do you mind giving just some summary of what you covered? So I know you started with talking about coronavirus in children. You talked a little bit about breastfeeding while being corona positive. And you talked a little bit about the different developing treatment options, none which have yet gotten full, FDA approval, many that are in clinical trials. Do you want to quickly summarize? And then if people want to contact you, where to find you for any follow-up questions?
Absolutely, absolutely. So what we've discussed today is that more than 80% of people who do get coronavirus will have a mild course. Children are the least likely to get a severe course. So children have the mildest disease process. And so, but still important to keep children at home because we don't want to be spreading the virus because children are often the way that the virus gets spread. Anybody older than the age of 2 when going out in public should be wearing a mask. Trying to limit public exposure is obviously best, but if that's not possible, then being smart and safe about it, trying to maintain 6 feet of distance and wearing a mask is always key. When it comes to those who do get significantly ill and potentially end up in the hospital, there are some treatment options that are being looked into. Hydroxychloroquine is one. While initial studies are favorable, there's still a lot more research to be done. Other antiviral options such as remdesivir may be helpful in those who are critically ill. Convalescent plasma means getting blood from somebody who's recovered from the illness to get their antibodies, and that's probably one of the most promising things we're going to see here in the future. We don't have a vaccine yet, but hopefully in the next year to come, this is something that will be rolled out and available. But in the meantime, the best way to prevent from getting this virus is to continue social distancing as much as possible, to stay home when it's possible, and if you need to go out, to protect yourself.
That's great. Yeah, so Rena, Dr. Mehta, thank you so much. Really appreciate all the sage advice, the words of wisdom. If someone wants to follow up with you, where can they find you? Now, one thing I do want to mention also, as my business is someone who owns a medical licensing company, one of the biggest sort of breakthroughs is that a lot more patients are seeing their doctors virtually, just like we're having this Facebook Live. Doctors are doing a lot more what we call telemedicine. And telemedicine, I think, is a critical tool for patients to continue to be distanced or isolated, but still have ability to have access. And in fact, the Trump administration did an excellent job of expanding reimbursement and coverage for doctors to advance practicing. I myself have been offering any free advice to any doctors that want to get licensed to practice telemedicine during this coronavirus period. So if there's any doctors out there that have questions about it, don't hesitate to reach out. How do we find you? And you're no longer in Bergen, but you're still accessible via telemedicine. Talk to us a little bit about. Tell us how to find you.
So the best way to reach me, couple of ways. You can go to my website, which is www.uptownallergyasthma.com, and you can send me a message directly through that. You can find me on Facebook, Uptown Allergy and Asthma. You can also email me if you'd like. It's Dr. Mehta, MEHTA, at uptownallergyasthma.com. So as a former physician in the state of New Jersey, I still have the ability to see patients through telemedicine. A lot of my patients are calling me, asking me, is there a cough from COVID? Is there a cough from allergies? Do they need to get tested? So if any of you have any questions, you want to talk about your symptoms, I'm happy to help.
That's great. Great. Well, Rena, thank you again very much. Really informative. In fact, I didn't know a lot about, about the things that you covered, especially, in terms of breastfeeding while being COVID positive. I know there's a lot of people out there that are delivering, still having babies. Life has to go on. And the question is, how do we adjust our life to make sure that we can be the best protected we can through this? Everyone is optimistic and that we're going to get past this and hopefully soon. In the meantime, we have to take caution. So again, Dr. Mehta, thank you so much for joining us and for that informative background on dealing with COVID-19 in kids and the different treatment options available right now.
Great. Well, thanks, Rick, for having me. Again, I would love to, if people have more questions, I'd love to do this again in the future.
All right.
All right. Take care.
Thank you.